Welcome to the Swasthyam second webinar follow-up session today. And we would urge you to ask any health-related queries or any questions about yesterday's webinar specifically, or anything related to your doubts about health or Ayurveda. Kindly get back to us in the chat box. We'll be answering your questions. Any doubts about Ayurveda or health in general, we would be very happy to help you out with the queries. So for the briefing done yesterday about the second webinar was all about the definitions of health, knowing of health. So how to assess yourself with regard to your health is concerned on the day-to-day basis, of course, and to be rest assured that your health is going good. So that was the whole point of discussion yesterday. And we also discussed about the factors which are affecting your health, either in a positive way or a negative way. So welcome you all for the follow-up session today. Kindly post your queries in the chat box and we'll be happy to help you out with the questions received. Anything about Ayurveda, anything about your apprehensions, or any clarifications about the science or health or anything regarding, we would be definitely happy to help you. Also, if you have not downloaded the Ayurdynamic app, kindly download the app and you can start any sort of discussion. There is a forum created so that you can start the health discussions even there. And all the webinar recordings also would be shared on the app. So kindly feel free to ask any health related queries about either yesterday's session or about Ayurveda and health in general. And also for people who are new to Swasthyam, I would like to tell you that it is an initiative which is created keeping in mind to promote holistic living and well-being among people, and also to spread authentic knowledge of Ayurveda as discussed yesterday. So because Ayurveda, of course, would be one of the future medicines, you know? So kindly feel free to ask any sort of questions which you have about Ayurveda. But interesting to discuss yesterday was the modifiable and the non-modifiable factors which influences health, because it's quite important to know that what affects your health, and what affects your health in a positive or negative way, and what among that is under your control and which is not under your control, which is modifiable and which is non-modifiable. Okay, so we have a question here which states, where do we get the app? Okay, so the Ayurdynamic app, the link was shared in the, okay, I'll just share the link here itself. So you could download the app, and you have a discussion forum there. And once you log in, you have certain write-ups and articles about Ayurveda, about in general about Ayurveda and Ayurvedic herbs specifically. So that you can access, and all the webinar recordings also would be uploaded there. So kindly download the app for multiple benefits there. So yeah, so the question here, hello Jana Taylor. Yeah, so I have high blood pressure, I have hormone imbalance, weight gain as a result of hormone imbalance. So I believe that these two are separate issues you have. And coming to the first part of your problem, regarding the high blood pressure, so it depends on whether you are diagnosed by a physician as having hypertension or you just have high blood pressure, because both becomes quite different. All of us could have high blood pressure at some point of time, like for example, soon after exercise, or after a walk, or after gym, or whatever. But that could be temporary. So having a high blood pressure is different from being diagnosed as being hypertensive. So I wonder, you are being diagnosed as hypertensive by your doctor and you are already on pills or not. So that is one query. And if you are diagnosed as being hypertensive, since how long are you on pills? So we'll have to know many more answer to many more questions like these. But if you're considering turning towards Ayurveda for the blood pressure issue, definitely I think you can definitely believe in Ayurveda for the blood pressure issue, because we have got many patients stop their allopathic blood pressure medicines, and some have reduced the dosage, some are off medicines who are recent in onset, and they have been maintaining with Ayurveda medicines and treatments quite a bit. So again, depends on many factors like your stress levels, your sleep levels, your exercise levels, your family history, and your other coexisting problems like um, if you have thyroid issue, or if you have other issues or kidney issue or whatever. So it depends on a lot of factor whether it could be controlled or not. But yeah, definitely Ayurveda is one promising thing. I've been on medication for many years and then was off. I'm back on it again. I have stress. Yeah. So that is one of the major factors. And but definitely, I think you can get a consultation. You would be, there is chances, since you were off medicines for 3 years, I think your levels wouldn't be that high. So I presume that. I urge you to take a Ayurveda consultation, and then after a careful history taking, you consider Ayurveda medicines to be taken for blood pressure. I would really urge you to do that, because definitely it would help. And even the treatments would help. Some of the treatments which are given in Ayurveda, like the Shirodhara and the detoxifications, etc., could definitely help you lower your blood pressure. And even there is a foot massage which is given in Ayurveda, which helps in blood pressure. So I think you should definitely consider that. I'm not sure from where you are, but if you have an Ayurveda center nearby, or you have a Panchakarma clinic nearby, I'm sure you should consult there. And the second part of your question, Jaina, is I have hormone imbalance. And weight gain. I'm not sure what hormone imbalance you're talking about. Is it about the thyroid, or is it about something like PCOS or something, or what hormone are you talking about here? Presuming that you're talking about weight gain, I would, and you have told low, maybe you're talking about hypothyroid issue or something. So even if it is that, I guess regular detoxifications would help you. Um, for that, because hormone imbalance is a slightly broader term to understand. We'll need to get some specific details about the hormone imbalances, about what you're talking about. Like, is it a um, you know thyroid related or any other related? And what is the pathology about? So that have to be understood. So I really encourage you to take a consultation before anything, because detailed history would help, because you have two issues at a time. Of course, the blood pressure also could be related to the hormones. That also is one thing. Um, so I really think you should take a consultation, and I'm sure the Ayurveda treatments would help, because if you're talking about thyroid issue, definitely that is also treated with Ayurveda. And if you're talking about blood pressure, that is also definitely treated with Ayurveda. But first thing I urge you to do is reduce your stress levels, because stress levels is something which can create a lot of problems, right from blood pressure to diabetes mellitus to hormonal imbalances, as you talk, to many insomnias and related problems. And so stress is something which takes a great toll on your health. That's what exactly I was talking about yesterday in the webinar, that psychological factors like stress can give rise to a lot of issues. Even we have examples of people who have developed autoimmune diseases and things like that. So I guess that is one thing which you should definitely try reducing, either with panchakarma therapies, and I'm sure even stress can be taken care. The one simple thing what you can do is, right now, if you have a lot of stress, try with meditations. Also try with the simple breathing exercises like pranayams, which can be guided. You There could be guidance about that everywhere. So please have a tutor. Please practice meditations and pranayams. And also, one thing what you can do is, you could give yourself a good feet massage on both your feet at night while going to bed. Any oil it could be. I could suggest a medicated oil only after consultation. But yeah, you can take a simple coconut oil or any oil, and you could massage your feet. Okay, so that could help you with your stress, with your blood pressure and everything. So that is one simple thing what you can practice at home even before you consult. Yeah, I guess so it is thyroid issues. You're most welcome. And yeah, for a detailed health history, please consult. Is all of my issues. Yeah, please do that. Please rub oil on your feet. Give a very slow, gentle massage on both your feet. It is good for, I'll tell you the multiple benefits of a feet massage. It reduces your blood sugar levels, and it could help you with your eyesight. It is good for eyes, vision, and it is good for stress and headaches. And it has multiple benefits, like even sleep related issues like insomnias. You could ping me on WhatsApp, ma'am. For booking the consultation, you can definitely ping me on WhatsApp. If you're in the group, I would text you back. If you're in the Swasthiam group created, I will definitely uh, message you back. Yeah, so I'll just trace you out and I'll message you back. Thank you for that. But yeah, have if you have even, yeah, diet should be taken care of. You should take a lot of diet care. uh, First we'll have to assess your body constitution, your age and everything, and then we'll have to uh, give a solution. So we will definitely work it out. So please feel free to ask any queries related to Ayurveda, or anything related to the yesterday's session, or anything related to health. Any doubts you have, if you have anything in your mind which you feel that um, you could be doing wrong, or if you're apprehensive about what you're doing is right or not, some simple practices which you're doing at home, so kindly ping back. I'd be really happy to help you. Okay. Okay, so we have a question. What are some example of Ayurvedic treatments? All right, so it's a very big question, but yeah, I would just tell you in a small way. Ayurveda treatments basically could be either in the form of panchakarma therapies, what we call. Pancha is five, so there are basically five types of treatment modalities, which includes the medicated vomiting procedures, vamana, a medicated gut cleaning procedures, which we call detoxifications, and we also have enema procedures, which is given through the bowels, and we also have the nasal root treatments like the nasya, which we call, where the medicated things are installed in through the nose, nasal root. And we have bloodlettings, and we have parasurgical procedures, and all uh, those treatments. We also have external treatments like the massages, which is generally taken as whole of Ayurveda, but it is not. Ayurveda is not only about massages as people think about. It is much more to it. So we have fermentations, we have various types of oil and ghee treatments, and um, we have treatments like shirodhara, which I just mentioned, shirodhara, or which we call a medicated oil or ghee, which is poured on the forehead, which is relaxing type of treatment, which could be you know um, done for various procedure conditions like insomnia or anything like that. All right, so hypertension and things like that. So we have various treatments, and apart from that, we also have oral medications which are given, like herbal medicines, mineral medicines, purely mineral medicines, or herbo combination of herbal and mineral, herbo mineral medicine. So we have a lot of medicines. And also the most important part of Ayurveda treatments, apart from these internal external treatments and medications and everything, and it is definitely a cherry on the cake for Ayurveda, is that it also recommends a high level of lifestyle changes, which is very very complementary to all the treatments given, because Ayurveda basically believes that unless and until you correct your basic lifestyle, like your sleep, food, etc., it is um, it is very difficult to solve a problem soon. So both have to be complementary to each other, like the lifestyle and medicines and treatments all have to go hand in hand. So this is what Ayurveda basically believes. And this is what is the so if definitely a feather on the cap for Ayurveda, because even if you go to contemporary medicines, it was until recently, a doctor would never used to ask about the lifestyle, about the appetite, about the bowels, about the sleep, about the all the food habits, everything. But this detailed history is always taken with patients if you consult an Ayurveda doctor. So you could have noted that difference. It is not only about your blood work, or it's not only about your symptoms in Ayurveda. It is about your body and your life, lifestyle and everything, your history, and all these things. So these are some examples of Ayurveda treatment. So specifically to tell you about Ayurveda treatments, it could be because it could be depending on your health condition, and if whether you're a completely healthy person who don't take any medicines, or you have certain medications which are to be followed, you're diagnosed with something. So it depends. We cannot suggest you Ayurveda treatments specific to you, but these are the general examples of Ayurveda treatments which are given. So depending on your condition, we suggest you whether you are suitable for enema or a massage, or things like that. So definitely we have some wonderful dental treatments. We have a few wonderful anorectal treatments, which you ENT treatments for that matter, even for the eyes, and so from different perspectives too. I guess Ayurveda has different treatments. Even from gynec point of view, for that matter, if you have any gynec issue, Ayurveda would be the best solution most of the times. So hope I've got an idea about um, you know what are the examples of Ayurveda treatments. But what type of treatment works for what could be definitely told only specific to a patient. It could not be told in general. So according to the disease, according to the condition, the types of treatments are advised. So so we could say that for most of these specialities, Ayurveda could be an answer, definitely, holistically. So kindly feel free to ask any questions about Ayurveda. You can put the questions in the chat box, or you can download the app and you can start discussions in the app as well, because the follow-up sessions could be the um, in a specific time. In case you miss the time, the app is always available. So, and also you can please feel free to unmute yourself and ask questions. So the whole idea here is to discuss Ayurveda, discuss the whole science in general, because it is a very very vast science. It's a very vast science. You you name the condition and will definitely can help you out with it. Okay, so we have a question here from Neelu. Is there a remedy to prevent frequent falls, unsteady gait, abdomen is large, having diabetes? Okay, so ma'am, I don't really get the meaning of frequent falls. I mean, do you fall because of blackouts? Do you really have dizziness and you fall down because of the unsteady gait? You fall down, and exactly what's your age? Have you got any dopamine tests done? Um, so these are quite you know different things. Uh, have you gone for any abdominal scan? Why is the abdomen large? Uh, so we'll have to. I have a bunch of questions here with all these vague symptoms. I'm not sure, because your frequent falls because of unsteady gait could be, because depending on your age, of course. If you are above 60, I'm sure you should be going for a detailed symptom evaluation with the doctor, or you could be going for a dopamine test. I'm not sure why abdominal. Were you diagnosed with some liver issue or kidney issue, or any heart issue, or is it because of the fat? I have a bunch of questions here which I'm not sure, because abdomen is large. See, largeness of abdomen is uh, told for various reasons. You know, either it could be because of the fat accumulation, or it could be because of the flatters, or because of the air bloated abdomen. It could be because of fluid accumulation, which is called ascites. So there are quite number of reasons. Okay, cannot walk without support. Are you above 60, ma'am? Are you what's your age like? Uh, Okay, so I guess if you have not gone to a doctor for evaluation, kindly do that, because your other symptoms um, could definitely come into picture, because unsteady gait in a young person could be because of various things, you know, because of the weak is it because of the weakness in your legs, or you don't get the coordination, or so this has to be evaluated in detail, I guess. I don't know, I'm not sure if you have already consulted a doctor for this, but this definitely needs a detailed evaluation. We need to know more. Okay, so your walk, if you're 67 and your walk is very slow, your gait is unsteady, do you have certain it's also important to know whether you have certain tremors in your hands, fingers, or you um, we'll do one thing, ma'am. If you're in the Swastham WhatsApp group, I would again contact you for the same, because I think this is something which we like really need to understand better. I would want to know about if you have tremors in your fingers, or you have difficulty in turning back if you're called from behind, and um, you know all all these things. What about your memory and things like that? So looks like some vaguely it looks like some um so it looks like some dopamine thing related thing, so definitely neurological. It looks like something related to the dopamine. So if you have not got it done, kindly get it tested, ma'am. I would really urge you to do that, and I'll definitely contact you for a better explanations about this. I'm sure you would find a solution. If you're in the WhatsApp group, I would definitely contact you, ma'am. Are you in the Swastham WhatsApp group? I would definitely contact you, because we'll need to discuss this in detail. What can help in ligament healing? Oh, definitely. Some pichus, or the some bandhas, the tying up of herbal oils and things. Uh, Definitely, it can help. We have excellent medicines in the surgery department of Ayurveda, where ligament tear and ligament injuries are definitely treated. We have certain bandhas which are bone strengthening, and some enemas which are bone strengthening, and some massages which are bone strengthening, some medications like laksha, astishrinkala. These are some of the drugs which are helping in ligament healing. So um, we can definitely help with that. There are some herbs like which are called as laksha and astishrinkala. So that will definitely prescribe to you, and 1 month of restricting the movements, and also the um, medications and treatments. Bandhas would definitely help. I've seen people, of course, ligaments take a little more time than bones, but definitely helps. So I guess ligament healing could be definitely done with from Ayurveda perspective, from of course the parasurgical department, where the orthopedics people see attend to you. Okay, so Neelu, taking Panchakarma treatment of younger full body massage gives relief to shoulders. Yeah, definitely, definitely. Provided there is no dislocation. I'm not sure what sort of shoulder pain you're talking about, but if there is no dislocation, I'm sure this would help. Especially if the shoulder pain is because of the osteoarthritis, it would definitely help you. Provided you have to make sure what is the cause of your shoulder pain. Is it because of the degeneration of your bones, which is called osteoarthritis, spondylosis in other terms? uh, Panchakarma treatment with Abhyanga oil full body massage steam definitely helps. In fact, that rejuvenation is needed for, most of the young people too. It is recommended for everyone, you know. So yeah, so it's the end of the session. Thank you so much all for coming up and asking such beautiful questions about Ayurveda. um, I will definitely get back to you. um, I'll have to search. Okay, Jaina Taylor, and yeah, I'll get back to you people for the uh, thing, or you can just message me on the Swastham WhatsApp as well. In the WhatsApp group for any health related queries, you can definitely ping me there. I'll be very glad to help you out. Or if you are from other field, I would definitely get you in touch with other uh, specialists as well, whom I work with, definitely. But we'll make sure that you are cured with Ayurveda. So thank you so much for joining us. We are very glad to have you people here and to know that you are interested in Ayurveda. Thank you so much. It was a pleasure talking to you all. Thank you. Thank you so much.